This next one is going to be the myths and mayhem of menopause. So I'm sure many of us can relate to that. We're very fortunate today to have Dr. Nadine Graven. She's one of our OBGYNs here at El Camino Hospital, Los Gatos. And Dr. Graven went to medical school at the University of Missouri and Columbia Medical School. She then did her residency at Ohio State University, and she is certified with the American Board of Obstetrics and Gynecology. And she has very many areas of specialty. One is menopause and hormone balancing, which we're going to hear from her today on. She's also a surgical specialist with the Da Vinci robot and also does minimally invasive surgery, female urologic surgery, and also complex obstetrics. And she's a member of the American Menopause Society. So with that, Dr. Graven.
Remember to turn the mic on. All right. I'm always, whenever I do these talks, I am always so pleased and amazed at the number of you that turn out for these talks on a Saturday. And I'm always happy to give up some of my Saturday to come talk to you because you're interested in your health. When I started doing these, I thought no one's going to show up, and look at this room. I mean, so I have to give you all kudos for coming and listening to us ramble on. Menopause. Grow old with me. The best is yet to be. The last of life for which the first was made. Robert Browning, one of my favorites. Or the Seven Dwarves of Menopause. Itchy, sweaty, weepy, sleepy, bloated, forgetful, psycho. The classic definition of menopause is the stopping of periods for 1 year. I don't think that's a very good definition. I have people that have absolutely no hormones in their body, and they have periods till they're 58 years old. It really is not a good definition. The average age of menopause, of really stopping and having your hormone production stop, is 48 to 52. And it's genetically predetermined. It is not related to when you start periods, your race, your height, or your weight. Probably a better definition is really sort of the perimenopause, which has been bandied about a bit. It's the gradual aging of the reproductive system, and there is no one size fits all. So hormones can come and go up and down, can quit suddenly, can do all sorts of patterns, and the periods sort of follow along. So stopping periods for a year, you can still have tons of hormones, you're just not producing progesterone, you don't have a period. So it really isn't menopause, it's more gradual aging. Symptoms, already talked about the seven dwarfs, got the hot flashes, got the brain fog, got the skin dryness, vaginal dryness, anxiety, water retention, insomnia, and yet, urinary frequency, bladder infections. The pelvis gets very rigid without estrogen, painful intercourse, irregular bleeding, heavy bleeding, sleep disorders, leg cramps, fatigue, breast tenderness, weight gain. When your hormones quit, you lose the ability to metabolize between 500 and 600 calories. So everybody comes in and says, oh, gaining weight. That is why. Increase in facial hair. Your estrogen actually blocks the testosterone production that you do. I can spot people not on hormones because they have chin hair and mustache hair. Estrogen blocks those, and you still produce testosterone long after your ovaries quit, and so that one continues and it becomes the dominant one. Depression. Estrogen helps keep your serotonin up, which is basically the equivalent of your own Prozac, and depression is very common. Joints get stiff because you lose a layer of water in them. Skin rashes. This is a big one, and actually I had a nurse that once came to me who had horrible rashes on her arms and legs, been to every dermatologist in the world. She was menopausal. She was an OR nurse. So they were blaming it on the fact that she had to scrub her arms all the day. And this is when I was early in my career, and I gave her some estrogen because she was having irregular periods, and lo and behold, all those rashes went away. Constipation is a big one. Palpitation, very common. We see this a lot in people with severe PMS too, which I think is also sort of gradual aging as well. And the palpitations come, estrogen controls some of that, and the heart just skitters around a little bit. It's not dangerous, but it's noticeable. It's kind of related to the hot flashes, where big vasodilation, same thing with palpitations, they're all kind of related. So why do we care? Other than who wants to live like that? Life expectancy in 1900 was 47 years. Today, you'll live 1/3 of your life in menopause. Heart disease, #1 killer of women, totally related to hormones and hormone lack. Osteoporosis, you heard from our previous excellent speaker about osteoporosis. When you lose your estrogen, it basically keeps the bone breakdown low. When your estrogen goes away, you start chewing up your bones. Alzheimer's, 68% increase in Alzheimer's when your hormones go away. Quality of life, you don't feel good. So let's talk about heart disease for a minute. #1 killer of women. 55 and older have a high cholesterol. At menopause, your HDL goes down. It's the happy cholesterol. That's how I remember it. I can never remember it, but happy cholesterol. And so that's the one that protects you. Your LDL goes up. That's the bad one. So it goes up. It starts sticking to arteries. Total cholesterol can increase by 6%, and your atherosclerosis go up. All of those things, if your average age of a period stops sort of at 52 or so, it takes 5 to 10 years to start having all these bad effects in your heart. So then you're in your 60s and your primary care pats you on the head and says, getting old, you're getting that heart disease stuff. And I got to tell you, this is preventable. The first symptom of heart disease in women is usually an unsurvivable heart attack. Women have smaller blood vessels, and they don't respond well to heart attacks. Men have bigger vessels, they do a little better. There's little or no warning. So you feel fine, doing good, maybe getting EKGs, none of which will show heart disease. It is 12 times greater than breast cancer, and more deaths are attributed to it than the next 14 causes of death. Osteoporosis, you just heard about osteoporosis. Now, I have a little different take, not different take on osteoporosis. The age that they want you to start doing DEXAs at 65, I think is too high. If you've lost your hormones in your early 50s, your maximum bone loss is pretty much occurred by 5 years. When I've done these lectures before, I actually take my bone density, it checks your ankle, and I always find 4 or 5 people, usually in their 50s, with thin bones or osteoporosis. So I think people need to be screened earlier, and except insurance companies say, well, we're not going to pay for that. But just to let you know, it's pretty sneaky. Women with hip fractures, 20% die in the first year, 50% never return to their previous level of functioning, 40% require long-term care. $18 billion a year. It is not a natural consequence of aging. It is absolutely related to lack of estrogen. You lose 0.7% of your bone mass from 35 on. Other factors, vitamin D, early menopause, alcoholism, Asian, and what I call the Pepsi generation, which stopped drinking milk a long time ago. The vitamin D has been a big interest Big study came out 4 years ago saying women in sunny states are still low in D. I didn't believe them. Oh, I don't think so. So I started checking people. I do 8 to 10 vitamin D levels a day, and in 1 month, I maybe have 1 normal vitamin D. Now, I'm a good girl from Wisconsin. I eat cheese, I drink milk, I eat my yogurt. I eat way more dairy than most, and mine was the bottom number of the normal range. So that was a little frightening as well. So I would very much encourage you to either get your D checked and start taking at least 1,000 a day, and I've actually upped that to almost 2,000 a day. I found that if women are low, 1,000 a day will keep you where you are, but you won't get into the middle of the range. So I would encourage you to get it checked and get on some vitamin D because it is very low. Early menopause people are very much at risk for early osteoporosis and heart disease, and they very much need to get checked. So I would encourage that, like our previous speaker. Your risk of hip fracture is greater than combined risk of breast, uterine, and ovarian cancers. Alzheimer's. We've determined that when you lose your hormones, the blood flow in your brain decreases by half. That's why you feel foggy. That's why you don't remember stuff. The lack of estrogen decreases your production of brain acetylcholine. Acetylcholine is the big player in Alzheimer's. When it's low, that's what they test for when they do Alzheimer tests. Estrogen helps that. It has good production. So, what do you do when you can't sleep, you pee too much, you cry at the GE commercial, you can't remember where you parked your car, your clothes don't fit, your face is breaking out, and your vagina feels like the Great Sahara. And your other half's complaining. Half the time I get husbands bringing in wives, which I think is very interesting. And if a male CEO of one of our local companies had any of these things, I can tell you they would get fixed in a heck of a hurry. Somehow women are supposed to put up with this, and that's just wrong. Hormone therapy. Nothing has been debated quite so much. This debate's been going on endlessly. There was a time in the 70s they thought estrogen increased breast cancer. That has been very much proved to be not the case. That is the big fear. That's in the media, and it's all negative. Studies in 2004, 2007, 2009, 2011, and 2012 significantly lower observed incidence in breast cancer in women on Premarin, the horse urine estrogen, 33% less. Stanford just completed a big study showing an increase in breast cancer in the placebo group. But did they call the Today Show? No. Ticks me off. There has never been a significant increase shown in breast cancer. CDC has been keeping records since the 1900s. There has not been a significant increase. We started using hormones like crazy in the 60s, 70s, 80s. You'd think if it was related, there'd be a parallel increase. There has not been. I call that my common sense statistic. So, estrogen increases your HDL and decreases your LDL. Keeps your blood vessels slippery. Lowers the total cholesterol. Direct vasodilating effect, that is the thing that causes hot flashes, so when you don't have that, your vessels go on, off. It also does not let you deposit things on your blood vessels. It decreases cardiovascular disease by 76%. You were meant to have hormones. You were wired for them since the age of 12. It keeps you healthy. Estrogen increases your vitamin D conversion and decreases bone resorption. Better than any of the bisphosphonates by far, and there's no incidence of jaw fracture, which by the way is very, very low, and other breaks. Huge decrease in fractures. Quality of life. Sleep improves. You sleep all night, you don't wake up. Without estrogen, you tend to wake up multiple times and you don't go into deep REM sleep. So then the next day you feel tired, You don't feel good. The libido and the vagina come back. You remember where you parked that car. Save money on air conditioning. Bones stay strong. Palpitations stop. You look like Suzanne Summers, hopefully. And your family and coworkers can actually approach you. 60 years show little or no association. Use of hormones at the time of a breast cancer diagnosis decreases the risk of death because you find the cancer earlier, not because it feeds the cancer, but because you develop an inflammatory response around the lump. People on hormones tend to find their lumps when they're still in the breast before they spread. Alcohol consumption and obesity are a far greater risk. And the media just plays the negative card over and over. Does estrogen cause breast cancer? Everybody buys that magazine, but they never come out and really say anything. This is from Consumer Reports. To balance what may be a negligible increase versus a huge proven life-saving effect on heart disease, osteoporosis, and Alzheimer's. Women who use estrogen live longer than those who do not. Here's a lovely slide. I finally figured out how to get it on my PowerPoint presentation, so I'm pretty pleased with myself today. There you go. The estrogen folks, they do better. Look at the non-users. Why are only 10 to 15% on estrogen? Scary. I have multiple doctors, even in my own specialty, that, well, you should probably stop that stuff. I have Medicare sending people notes saying, you should get off those hormones. They don't want to pay for them, by the way, but they pay for Viagra. Makes you nutty. At any rate, that's why I do these talks on Saturdays. And really finally, I love this. Would have taken better care of myself. Mr. George Burns. So, there's going to be a menopause support group that's going to start, which is very exciting. I'm going to help out. And at any rate, Bonnie's going to come up and talk to you a little bit about that, so I'm really excited to hear that we're going to start one of those. I'll just stand.
Just be close buddies. Hi, it's great to see all of you here today and learning all of this wonderful information about menopause. So as you heard, we are starting what we're calling a menopause support group, and what that means is we received a grant, and the grant was specific around developing resources for women, whether they be on a website, whether they be blogs where you could ask questions, whether they be doing speaking and presentations like what you're hearing. But we have a number of ideas of what we would like to offer for women in regards to menopause support. And you can see some of the ideas that are listed on the slide here. What we would ask you to do, if this is a topic that's passionate and touching your heart in some way, that in your bag there is a menopause needs support survey. And so if you would, Michelle is showing what that is. It's on the front and there's a few questions on the back. If you could take a few minutes and give us your feedback as we are developing this program. We really want to make sure it's meeting the needs of the women in the community. And once you have that completed, if you could return that to me, I will be at the table right outside the door. It says Pelvic Health and Menopause Support. Stop by and hand that to me. I may ask you a few additional questions. And then we have a giveaway, a small gift as our appreciation for you taking the time to do that for us. So it's, with a lot of appreciation that we, thank you for taking a few minutes and telling us if any of those are part of the program that you would like to see developed. Thank you.
Thanks, Bonnie. And thanks, Dr. Graven. Can we all give a round of applause for Dr. Graven? So I know we have 5 minutes for questions for Dr. Graven, and then Dr. Graven will be at the Ask the Expert table. We have the woman here in the front. Raise your hand very quickly, so we'll get you first.
I was part of the Women's Health Initiative on the estrogen program. What do you think of that? Because they closed that off, and apparently I was on the real thing, but they took us all off of it because they said it was causing breast cancer.
Which was actually not true. The problem with the Women's Health Initiative is that they were studying heart disease, and they went back and cherry-picked through all the people that had signed up originally and picked people to be in the study. So it wasn't, it was really taking another study and morphing it into another. They had people from ages 50 to 65, and they were starting people on hormones in their early 60s. They were starting them later than that. And what happened was you had this whole mixed group of people, some of which had already developed all the risk factors because they'd been off hormones for a while, and then they started them with the Women's Health Initiative, and there was no rhyme or reason to who started and who didn't. And so it's very murky. There are a lot of people, they did say, there's a couple places in the Women's Health Initiative where they said, well, we noticed that people with heart disease didn't get worse when we started estrogen. And that was very interesting because that's exactly right. Estrogen's not roto-rooter. If you've already got, bad bones and a bad heart, it will increase your bone mass, but it doesn't go back and roto-rooter out the heart valves and the heart vessels, but it does keep you constant. The other part is that there was a group of women that had hysterectomies at the Women's Health Initiative. They kept going for another 2 years. And what they found is in that group of people, there was definitely a decreased incidence of breast cancer, and all the things that were good, prevention of heart disease, osteoporosis, and all those other things, were very much there. But that, of course, they didn't call the Today Show on that one. So not a great study, as I would call it. So those of us in menopause are really frustrated with it. So.
Do you recommend this for people like the late 60s, or and has any of this been written up in like JAMA or any of those professional magazines?
I'm sorry, the question is, do I recommend
Do you recommend this estrogen, taking some form of estrogen to people in their late 60s who've had a gap, as you say, like they stopped, like they stopped whatever, menopause, whatever, at 55 or older, or and there's like a 10-year gap in this kind of thing?
I do. I have people that have been developing Alzheimer's. I've had a couple of daughters actually bring their mothers in, and there's good data to show that you do get an increase in the acetylcholine, and it actually helps. And so I definitely believe in putting people on real low dose. It will arrest the bone loss. It'll do all the things that it's supposed to do. Maybe you've lost some stuff, okay? But you will arrest it at that spot. So I don't think it's ever too late to start. Everyone loses bone mass. Doesn't matter. I mean, when your hormones are gone, your bones go away. The rate at which they go away can be changed slightly with megadose calcium vitamin D. But they march on down. It doesn't matter if you're aerobic queen, taking your calcium, drinking your milk, you still march down.
Okay, does Alzheimer's, have they tried estrogen on patients to see if there's an improvement at all? Have they done anything open to it?
They know that their big study was out about 6 years ago that showed that it very much decreased the incidence by 60-70% in women. I don't know I think they were going to go on, they haven't published it yet, on whether or not people with Alzheimer's should go on estrogen. My own personal experience is that it has improved the patients that I have put on it who have Alzheimer's. It has improved them. Hasn't made it go completely away, but it has improved.
So then if we suspect we're getting it, we better come to you.
Or get on some hormones, yes ma'am.
Great. Well, thank you so much. Dr. Graven will be at the Ask the Expert table in the back. Thank you so much. Great presentation.